Recent studies have shown that in India, nearly half of all pregnancies are unintended, and abortions account for a third of all pregnancies. The numbers are similar in England too, as 45% of pregnancies and a third of births here are unplanned. According to World Health Organization, 74 million women in low and middle income countries have unintended pregnancies each year, leading to some 25 million unsafe abortions and 47,000 maternal deaths annually. Yet, around two-thirds of sexually active women surveyed in a United Nations study indicated that although they wished to avoid or postpone having children, they had stopped relying on contraception out of concern for how it was affecting their health. Namaskar, hello, welcome to my channel. My name is Pritha. I'm a gynecologist working in London now, but I am an Indian and trained in India, and today I will give you the ins and outs of birth control. Now, a woman can get pregnant at any time, from adolescence to menopause. It is possible for young girls to get pregnant even before their first period starts. And even though fertility usually diminishes with age, one can still get pregnant after periods stop with menopause. Generally speaking, women who are less than 50 years old need to continue contraception for 2 years following the last period, and for those who are more than 50 should carry on for a year. After that, it should be safe. Also, especially important to recognize is that breastfeeding is not a reliable method of contraception, and pregnancy can happen anytime after any pregnancy event like delivery, miscarriage, or abortion. There are various types of contraceptions available, and individual health and circumstances are considered before making medical recommendations. Also, just to let you know, there are at least 13 options for female contraception, and guess how many there are for men? Only 2. First, let's talk about barrier methods, and men, I'm going to start with you guys. Male condoms can be made of natural latex, synthetic latex, or a plastic derivative. With typical use, they are about 82% effective. Lubricants can be used with condoms, but additional spermicide is not needed. They do not have serious side effects but need to be worn and used properly without any slip or spill, or else it pretty much beats the purpose. They are also the only reliable way to avoid sexually transmitted infections, and I cannot stress this enough. Whilst I would not recommend condoms for birth control for people having regular intercourse, if there is any risk of getting an STI, please also use a condom. There are a couple of other barrier methods available for women like cervical caps and diaphragms. They need to be fitted up to 3 hours before sexual intercourse and need to stay in for 6 hours afterwards. And additional spermicide use is advised. They come in different sizes and are about 70 to 88% effective. Female condoms can also protect against STIs and are 79 to 95% effective, but they are not widely available. Next up, I'm going to present the hormonal contraception. There are 2 different hormones that primarily act on female reproductive organs, estrogen and progesterone. Hormonal contraception will have synthetic varieties of either progesterone only or a combination of both, and can be delivered into the body by different means. They act by thickening mucus produced by the neck of the womb, thereby making it difficult for sperms to travel inside the womb. They can also thin the lining of the womb, thereby preventing conception, and sometimes also stop ovaries from producing eggs. One way of hormonal contraception is by orally ingesting them like pills. So we have combined oral contraceptive pills, which as the name describes contains both estrogen and progesterone. The standard way is to take 1 tablet once a day for 21 days, and then you have a break of 7 days when periods can happen. They are between 91 to 99% effective depending on how frequently one forgets to take the pills, and once they are stopped, fertility returns soon after. They can cause some temporary side effects like headache, nausea, mood changes, and breast tenderness, and rarely some serious ones like blood clots in legs or lungs. There is, however, no evidence linking combined pills with weight gain, but you cannot take it if you are a smoker over 35 years old or if you are significantly overweight. They are also not suitable for breastfeeding mums. Combined pills is not just one formulation though, there are different options which contain different doses of estrogen and progesterones with different chemical compositions. Often, if you are intolerant to one form, you may be well suited for another, so your doctor may try a few different kinds before settling with one. One advantage of these pills is they do make periods lighter and help to control period cramps too, and are particularly suitable for those with heavy and painful periods. In fact, these are offered as treatment for a lot of gynecological conditions. Some types of pills will also help clear acne, and there is some evidence suggesting combined pills reduce the risk of cancer of ovary and womb. The other oral tablet option is the progesterone only pill, popularly called mini pills. They are also about 91 to 99% effective and need to be taken once a day. And it is important to be taken at around the same time every day, otherwise, they will not work. They can be used in situations where combined pills cannot, like breastfeeding and in overweight women or smokers over 35. They might also cause headache, breast tenderness, acne, or some weight change and may make periods irregular, especially in the early months, but fertility returns soon after stopping. Combined estrogen and progesterone can also be released into the body through a patch that is put on skin or a ring placed in the vagina, which need to be worn for 3 out of 4 weeks. The advantage is that one does not need to remember to take tablets, but I'm not going to go into the depths of them as they are not widely available across the globe. Some medications may make pills, patch, and ring less effective, so make sure you mention what medicines you're having to your doctor before starting them. For women who have regular sex and do not have any immediate plan of getting pregnant, but wish to keep the option open, we would always suggest a long-acting reversible contraception, which we lovingly called LARC. For those who have recently been pregnant and wish to delay the next one, these are strongly recommended and they are all compatible with breastfeeding. First, I'll mention about the favorite of gynecologists, an intrauterine system, which is a T-shaped progesterone-coated plastic device which stays inside the womb for anything between 3 to 5 years, depending on manufacturer, or you can have it removed earlier if you want. It releases progesterone, but because user is not consuming the hormone, systemic side effects are less, and it is 99% effective, so super effective. It is particularly useful for making periods lighter and dealing with period pains, and in fact is a popular treatment for any condition that can make periods heavy and painful, like endometriosis and adenomyosis. It does not usually require any anesthetic for insertion, and fertility returns once it is removed. It can make periods stop whilst in use, but do not worry, that is only a temporary feature. In the first few months of use, there can be some spotting or some pain, and there is very small chance of getting an infection with insertion, and often doctors will prescribe a preventative antibiotic. Progesterone can also be delivered into the body with the help of an implant, which is a small rod that is put under the skin of the upper arm. It stays for 3 years. It can stay up to 3 years, is 99% effective, and fertility returns soon after use. It takes a little procedure under local anesthetic to fit and remove, and it is not visible, though you are supposed to feel it. It can make the periods irregular and lighter. The other way to use progesterone as contraception is by the depot injection. It is 94 to 99% effective and can last for 8 to 13 weeks depending on the manufacturer. It can also help with heavy and painful periods and may make periods irregular. Some women, though, experience weight gain with depot injections, and unlike all the other hormones, return to fertility may be delayed with this one. If you want a lark but hormones make you nervous, there is one for you too. The humble copper intrauterine device. It is also a T-shaped device made with plastic and copper with no hormone and can be put in the womb without any anesthetic. Depending on the type, it can stay in for 5 to 10 years. You can remove it early if you want. It's 99% effective. It can though make the periods heavy and painful, and there's some risk of catching infection with insertion, which can be minimized by an antibiotic cover. There are a couple of permanent birth control options, and we call them sterilization. In women, it involves cutting or sealing a part of the tubes that carry egg from ovaries to the womb, and is done either by keyhole surgery or by making a small cut on the tummy. It requires anesthetic and carries risks of operation, but chances of serious side effects are small. Failure rate is 1 in 200. However, please remember you will need additional contraceptive for the first cycle. Reversal of this procedure is difficult and often unsuccessful, so please consider this as permanent and make sure you have adequate counseling before going down this route. I started with men and I will end with them, but first a huge round of applause for the men who are watching this video on birth control. Good going, guys. The world needs more of your kind. Good job. Now, men, for you, sterilization or vasectomy is a much easier procedure than the female sterilization, with less failure rate of 1 in 2000. Here, the tubes that carry sperm from testicles to penis are cut and tied or sealed. But please remember that the tube has significant length. Until the entire length is not free of sperms, you can still impregnate. This can take up to 8 weeks, and additional contraception is needed till semen analysis gives you the go-ahead. This is also considered permanent for all practical purposes, and reversal can be difficult, so make sure you are sure. Lastly, I will briefly touch upon the methods of natural contraception. There's something called calendar method, where you do not have sex at around your ovulation time. That is going to be roughly around mid-cycle for most women. I believe there are some apps too nowadays that help with it, and personally I feel this is much more suited as a fertility measure than birth control. It is, however, about 76 to 99% effective depending on how much self-restraint you have. Some people also practice withdrawal method, but it is so unreliable that I won't even go there. I feel I have to mention something about emergency contraception here. The name is self-explanatory. It is only for emergency and not meant for regular use. And the earlier after an act of unprotected intercourse it is taken, the better. There are 2 different types of pills that can be used. One needs to be taken by 72 hours and the other one by 120 hours, which is 5 days after sex. The other option is to get any one of the coils fitted by 5 days. The advantage of the coil is that it can stay in for long-term contraception. You may also need additional antibiotic cover to prevent sexually transmitted infections. The best method for birth control is honestly abstinence, but I hope in the last so many minutes I've been able to prove that it is not really necessary, because there is something for everyone. If you had forgotten your notebooks and now cannot remember any of my gyan, do not worry. Head to the video description and you will find links to all the resources you will possibly need. And please consult a doctor before starting any medication. Have fun, guys, and be safe. Wear condoms. Bye.